Rachel Robinson, and I'm a professor in the School of International Service at American University. The title of my book is Intimate Interventions in Global Health, Family Planning and HIV Prevention in Sub-Saharan Africa. The book demonstrates that countries' histories of health interventions determine and shape how they face new health threats. And it does so by looking at the relationship between family planning and HIV prevention in sub-Saharan Africa, with a particular focus on Senegal, Malawi, and Nigeria. So both family planning programs and HIV prevention programs are examples of what I call intimate interventions. And these are programs, policies, and organizational actions that aim to change sexual behavior in the name of individual or collective good. Countries that had a strong family planning organization that predated the HIV epidemic went on to experience greater declines in HIV than those that did not. For example, the Society for Family Health in Nigeria was important to providing family planning and then became a major player in the response to HIV. In addition, countries that received lots of money for family planning from global donors also went on to receive lots of money for HIV, regardless of the nature of their epidemic. Of course, family planning programs weren't the only thing that mattered to countries' responses to HIV. In particular, the strength of civil society, the nature of political leadership, and the existence of scientific leadership also matter. For example, in Malawi, the longtime authoritarian ruler, President Banda, was reticent to address family planning needs as well as HIV, and for very similar reasons. In Senegal, in contrast, the existence of Senegalese researchers who gained legitimacy through discovering one of the main types of HIV allowed them to convince political leadership of the importance of taking early and direct action. Donor funding, of course, comes with strings attached. And the strings that matter in the realm of family planning is something called the Mexico City policy or the global gag rule, which makes it illegal for any NGO that receives US funding to even mention abortion. All previous Republican administrations have enacted this rule. The Trump administration has taken it further. It used to refer to about $600 million of family planning money. It now applies to the nearly $9 billion that goes towards global health as a whole. Unintended pregnancy and HIV transmission remain major issues in sub-Saharan Africa. So global donors need to maintain their funding, but local organizations need to press African governments to commit as well. My book shows that family planning efforts helped build health systems, and that family planning thus has global health impacts.